Hi. Hi, my name is Angela Michelle Savino Pilla, and I am a social work student, an MSW student here at Loma Linda University in the School of Behavioral Health. And my topic for today, it's Religion 540, relational religion, integrating wellness, wholeness, and health. And this is a holistic vision for clinical practice, and it's my reflections from this past semester. And one thing I really loved this semester that I found very helpful was that each lecture we had started with scripture. And that was one of the reasons why, in fact, the primary reason why I came to Loma Linda to really work in the spiritual aspects of our work and to use it in my clinical practice in appropriate and respectful ways. So I'm going to start with a scripture, and I'm going to use one of my favorite ones, and I'm going to break it out a little bit, take it out of order, because I think it speaks to the lessons that I learned throughout the semester, and also, you know, how to integrate it and balance it for future and for current and future clinical practice. So in 1 Corinthians 13, verse 11, it says, "When I was a child, I spoke as a child. I understood as a child. I thought as a child. But when I became a man, or in my case, a woman, I put away childish things." And I feel like that um, that verse alone really speaks to my experience in this class. Because um, at this stage of my life, at this chapter of my life, I've seen a lot of things and I've lived through a lot of things. And I think one of the most concerning things, disconcerting things sometimes, really, is having lived through many things. I'm appalled sometimes that we still haven't reached the level of care, of love and respect for others. And I think I'm really appreciative of my social work values that align and is very much in tune with the person. And it starts with the micro individual to the environment, the meso level of environment, family, caregivers, church, community, and then on the macro level, which is societal, our country, and a global level. And at the end, I like to speak to some of that in terms of some of the new things that are being said by a recent UN report from April. So I feel like as a person in this stage, having decided to go back to school, I came because I wanted to learn as a lifelong learner, of course, but also at this stage to also unlearn and relearn and really develop some new habits, sustainable habits, habits that are persist, that are embedded. So I bring it to all I do on a micro macro level, make micro meso macro level. So that brings me actually to the second part of the scripture, that though I speak with tongues, that's verse 1 of Corinthians, 1 Corinthians 13, verse 1. Though I speak with the tongues of men and of angels, but have not love, I have become sounding brass or a clanging cymbal. And in the third verse, and though I bestow all my goods to feed the poor, and though I give my body to be burned, but have not love, it profits me nothing. Um, I think all of this speaks to the lessons that I learned, and I think it also speaks to the definition in the first part of wellness and wholeness and health. And I'm going to take each one, each component, um, and I'll tie it together. This will make sense. So wellness is distinct, although a lot of people confuse it, and there's a lot of confusing definitions out there. But from my understanding from this class is, first of all, wellness, wholeness, and health is beyond just the physical, and it's beyond the medical model that just says, okay, a person gets sick and we're going to give some antibiotics and treat and be done. It's wellness is an ongoing process. Wholeness, health is essentially the goal. And the goal is on an micro, meso, macro level. Individually, self-care, which I'm finally trying to learn to get out of my system, that it's not selfish. And so much so that the ethics class that I'm taking with this class is teaching me that even the code of ethics has incorporated a section to avoid burnout, because what good is we burn out our social workers and we are not there to function professionally and well, optimally well for our clients and patients. So wellness I see as an ongoing process. It's a holistic integration. It's a striving every day to do better and to keep working on those four domains, which is physical, mental, emotional, spiritual. Certainly that's all I thought it was when I came to Loma Linda, but the lesson, the huge lesson I learned, and I'm going to bring in topic 2, section 2 with the lessons learned, is wellness on an individual and health and wholeness on a macro level. And I see it as building on wellness builds into wholeness and health for community and for society. It has to bring in physical, mental, and emotional and spiritual, but it must bring in social factors. They used to be called social factors, social determinants, like income, vocation, okay, housing, food. All of these are determinants of health. And aging, by the way, I've learned this semester, it starts when we're young, and we need to change. We need to change our system, that education is holistic. Okay, let me get back to this. So wholeness, health, basically, wellness is the process. Wholeness, health takes in, of course, each of the four domains. All of wellness and wholeness and health takes in the four domains: physical, mental, emotional, spiritual. But the new lesson that I learned is it also takes in the social determinants. And another way of saying it is now is as they impact health outcomes, and health disparities, okay, and disproportionalities in terms of that those outcomes. It's now health determinants. Social determinants are health determinants and are part of wholeness, health. So wellness, individual to wholeness, health, and each builds. So I hope I clearly stated my definition. And the big lesson learned from me this semester is the fact that social determinants are health determinants, bear on health outcomes that become health determinants. And the big lesson that I learned from my social work practice is that we need to utilize these concepts in very pragmatic ways. We need to find out the resources that are available. And when I say available, it also means accessible, that we get very, very nuanced in terms of available, accessible, feasible resources. And this comes in healthcare. It comes in healthcare, in health, in our health practices. To be honest, I'd like to make a compelling case that social workers should be part of the medical healthcare model. We saw it being used in at University of California, San Francisco, in that wonderful lesson in one of the modules that spoke about this example of a mom who brought her son in and he had a ruptured eardrum and was now on his second ruptured eardrum. And the doctor wisely, looked into, well, what's going on? Like, how is it that the antibiotics are not working? Well, because the antibiotics weren't working because the refrigeration wasn't working correctly, the housing. So the nurse practitioner was able to get in and find resources that day in terms of housing, electricity, and making sure that those antibiotics were going to be taken to prevent a ruptured eardrum. And I will tell you, that is serious stuff. I had a ruptured eardrum at an early stage in my life, and infections, and I still have problems with this ear. So that's health. That happened at an early age, and it's a visceral experience that I think needs to be brought out in practice. Those are the pragmatics. So that's my third question. Which topics were new to you is also in terms of that example to say that we can pragmatically look at these social determinants, and we need to. There's another further learning experience I had, like UC, San Francisco that was a beautiful example, but there's also an example at Johns Hopkins with the Dr. Wu, and it's in the reference if you'd like to take a look at this article about this well-beloved doctor, professor, who has incorporated this for many years of dovetailing into weaving resources for his patients, but also for his colleagues, the nurse practitioner that is helping him on a daily basis when he suspects that there might be burnout, within the community to work that through, within their work environment on the micro level to make things, to avoid burnout and the great respect that this doctor has for his colleagues and the students, the interns that come in from Johns Hopkins. So again, this whole holistic and building on what we're learning and building on it every day so it becomes habits and becomes embedded and it becomes sustainable. Those are the lessons that I'm learning from this class in section 3 and 4, and that I am bringing right now, to my clinical practice and to others just on a natural level. These were things that I was doing, with my own, my son many years ago, with special needs that from parent to parent, bringing in to 11 resources or, regional center. One of the things that I need to do for further learning, there are one among 3 different things I like to do is really come up with a binder like that defines all the community resources here. I've done this with respect to ADHD, but certainly, things keep evolving and changing. And I like to do it more in terms of healthcare, like especially at the Loma Linda University community. I did my practicum last year at the Resiliency Clinic, and it's a slide scale resource, which, I was able to use then when I was doing group therapy with some of the students, a very, very diverse student body at a local academy affiliated, and able to also get assessments to be done, on a slide scale or no fee basis that, it's holistic, person-centered, and it's available. It's here. It's excellent, excellent resources. Students are learning from this. It's, 360 degrees, and it's accessible. And if for some reason there's a transportation issue, then we could work through and get the transportation issues resolved. So that's what I mean about the further learning for me is I want to develop and really tap into more resources, and I want to learn how to be a better, I've taken classes too many years ago for grant writing to get these things done. The second thing I'd like to learn about is I reference this wonderful article. He actually wrote a book. It's called it's Bart Wilson. His name is Bart Wilson, and it's called Meaningful Economics: Making the Science of Prosperity More Humane, More Human. And that's another thing I'd like to learn more about. Let me go make sure I'm very good. Okay. What I also learned is from this class is the relationship wholeness and wellness. Wellness, wholeness, health takes in sustainable economics. And it's one in which the United States and all nations need to proactively, preemptively, and collaboratively, and that goes into my April 2025 article I'll bring up in a second. We need to shape our economics, our policies, our economies, our healthcare outcomes, and again, me, you, all of us, our daily practices that are health related equity is coming in, social determinants, health determinants, the inputs, the health inputs that we're doing this on a 360 basis, micro, meso, macro. How am I doing on time? This definition may encompass patients and communities who are, okay, in the pandemic, we saw in live time I knew, most of us know about the pre-existing disparities, but it worsened. The pandemic worsened the pre-existing disparities in inequities and institutional racism and bigotry and for marginalized communities. So, okay, so now we know this. So now we need to do better. Going back to the scripture, like we need to pivot more every day about this. So economic policy, again, holistically needs to take in. And Bart Wilson, if I could just find this wonderful. Excuse me. Huh. Essentially, okay, I'll say it as best as I can. Okay, here it is. I think this is it, maybe. Okay, here it is. Well, basically, organizations, leaders, we've been through a global pandemic. We have all this technology. We need to reinvent organizations. So, when I studied economics in college, they spoke about guns and butter or butter and guns on each axis. I didn't even understand that. Like butter being a luxury, I guess, at that time, and military guns being a necessity, which tells you the values of this country, even in 19, too long ago. But this gentleman, Mr. Wilson, Dr. Wilson, is basically saying we have the resources, we have the technology, we have the imagination to create something that could imagine a world without disparities and disproportionalities, and we're ethically obligated that this should be part of our ethics every day to be doing something about it. And that's a lesson that I am going to be studying this summer. I have the book actually for those. It's accessible through the Loma Linda Library, and I'm going to be reading that. I think that is required reading for social workers and people in whole health. And that actually, I'm going to bring in tail in. Let me make sure I have everything. Oh, let me bring in then the UN. I'm sorry. Clinicians must take in the current economic situation, yes, but this Gutierrez brings up in his UN social report of 2025. I'm going to read it, and it's in the reference because I don't want to I don't want to do an injustice to it. We need to be aware of this reported trend. Okay, besides economic insecurity, staggering levels of inflation, levels of inequality, there is this social trust. And of course, we've seen it in this country in the last too many years of this divisiveness, this horrible divisiveness. And I will tell you, like education is even differently from when I had initially gone to school, that to have differing views was a good thing. That's where we listen and we take it in and we collaborate and work together through it. We mediate that. And that is my background, to advocate, mediate, and work together on creating change. So, but this declining social trust and the social fragmentation is destabilizing societies worldwide. In warning of this global crisis, the UN is calling for a new policy consensus and demands immediate and decisive, not divisive, decisive policy action to restore trust and social cohesion as innumerable people struggle to make ends meet, driving frustration and deepening divisions and right now unsustainable developmental goals. The United Nations is saying that we're woefully off track. How many minutes? Okay, so I'm going to tie that in actually. Okay, so one of the other big things I learned is, okay, about nutrition. Like social workers, we should all have gardens in front, container gardens, whatever it is, as that lovely New Jersey couple did. And start composting, start doing things every day. But what the other part of it is, we're coming from economic growth that was unsustainable. And now we're in this, austerity, which is equally unsustainable. We need to find a balance in between. And to be honest, like without even getting into the politics, but I'm going to get into it when I talk about Dr. Gaudet or Dr. Gaudet. Tracy Gaudet was one of the assigned readings we had that I think sums up for me what I really learned over here and what we need to take with us. Is that, that we need to find a balance and we need to do it on our own. Forget about what's going on in Washington and all the chaotic and the immaturity, to say the least. We're not ignorant. And I think I'm going to just pull out this article. It is Dr. Tracy Gaudet article that I think we had to read. I think it was as early as the first or second module, and I'm going to read it so I don't. It's also referenced. It's on the second page of references for this presentation, and there's like 6, and then there's 2. She's a doctor, and it looks like a doctor who has a lot of really good experiences. The first thing that she says, and it's the first thing she says, and it's in the abstract, so I'm going to read it for brevity's sake. Perhaps the biggest risk facing the efforts to improve health and well-being. So here we are with our definitions, okay? Well-being, health, wholeness, and health. The biggest risk facing efforts to improve this is to fail to realize that this requires not simply improvement upon the existing systems, but true, and she capitalizes true transformation. In transformation, not one massive complex system, but of a multitude of systems. The whole Health Institute, she has identified some 13 different large systems, and I would reference going back and rereading this essential article, because what she does in this excellent article is she gives you the politics. And I thought this was like stunning the way, yeah, my own lived experiences of how it works, when they ignore you and then they pay attention to you, but there's usually resistance, then they co-opt from you. She uses, it's all spelled out here. But what I really want to leave with, and I think ties in this integration is, so why do we do all of this? And really, on an everyday basis, do we make a difference in the multitude of systems? And I like her answer. She said, given how hard this is, why do we all persevere in trying to drive this change? For one reason, because of what is possible when we succeed. When we succeed, we will see increase in physical and mental well-being, decrease in pain, obesity, depression, and chronic conditions, increase in self-care, which means, bringing in healthcare literacy, and cultural competency with that on a 360 level, decrease in clinical and pharmaceutical needs and decrease healthcare costs, increase in employee engagement and business productivity, less burnout, increase in people's sense of meaning and purpose. And if you read the article, that's where we start, not at the end, not at this stage. Like, this needs to be in education at the beginning to increase people's sense of meaning and purpose, that yes, when you take care of your diabetes, okay, it's meaningful on many levels. Okay, connectivity, okay, increasing people's sense of meaning and purpose, connectivity and compassion, and a transformation in social consciousness and a quantum leap in health, well-being, and collective humanity. And I'm going to stop talking right here. And that is it in a nutshell for me. And I am so appreciative of this class and all I've learned. And I really wish there was another class in spirituality and wholeness health, but I'll find it in all the resources, the great resources here on campus. And I wish you all like many blessings, and I thank you all. Take care. Bye.